Hi, my name is Giovanni Joel González Ochoa. I belong to the Santiago de Guayaquil Catholic University. My subject is randomized trial of lactin B to prevent recurrence of bacterial vaginosis. Definition: Bacterial vaginosis is the name given to a condition that occurs in the woman, in which the normal bacterial balance in the vagina is disturbed and instead certain bacteria overgroup, especially Gardnerella vaginalis.
Bacterial vaginosis is a name that can initially sound quite scary. However, it's not as scary when you find out that actually 1 in 3 women will get it in their lifetime. Bacterial vaginosis is different to thrush in that it's a bacterial infection, whilst thrush is a fungal infection. Bacterial vaginosis, or BV as it's more commonly known, simply happens when there is an imbalance in the normal microflora of the vagina. When this occurs, different reactions happen and can cause us women a lot of stress. Yes, BV is worrying, and you may know it's there because you notice an unpleasant fishy odour and greyish watery discharge. The symptoms can worsen after sex, but BV is not sexually transmitted. However, to reassure you, bacterial vaginosis is the most common vaginal infection in women who are of childbearing age. Again, that's a lot of women, so you are not alone. The symptoms can be easily treated with over-the-counter solutions, such as Canis Balance. Canis Balance provides a triple benefit formula to firstly, relieve the fishy odour and greyish watery discharge associated with BV. Secondly, it hampers the growth of the bad bacteria that causes the odour and discharge. And thirdly, encourages the growth of good bacteria to keep the bad bacteria from overtaking the vaginal flora, all in 7 days. However, you can start to see a difference in just 3. Caniston, get comfortable.
Lactin B CTB05. It is a common root-shaped species of the genus Lactobacillus and is hydrogenoperoxy that produce beneficial microbiota species located both in the vagina. Through vaginal secretion, the CTB05 strain is used as a probiotic that can be used by premenopausal women that postmenopausal women who experience recurrent urinary tract infection. Application in nursing. Number 1. Educate the patient on the correct cleaning of the genital area. Number 2. Administer and teach use of topical antifungal medication. Number 3. Educate the patient as to how much sexual intercourse should be avoided. Number 4. Be attentive to any allergic reaction. Pros and cons. The positive is that using this method, it is possible to reduce the incidence of bacterial vaginosis. The negative is that some patients might have adverse reactions, such as burning and itching. Issue appear in Ecuador. Bacterial vaginosis, candidiasis, and trichomoniasis represent the environment at the level worldwide. 90% of cases of cervicovaginal infection in women of age, reproductive. The most common risk factor for bacterial vaginosis has been identified as unprotected sex, no condom use, douching, shortage of lactobacillus in the vaginal flora, and new sexual partner. Conclusion. Bacterial vaginosis is an infection to consider signs. It has a high prevalence in women and can develop complications such as the risk of developing pelvic inflammatory disease and infection of the genital tract superior, involving the uterus and fallopian tube, behind the main reason for infertility and sterility. Book down to medical advance using CTB certified, the incidence of bacterial vaginosis has been reduced. Thank you.